Hello, my name is Kari Knapp. The easiest way for me to explain my art is to share with you who I am and where I came from. I was born in Fargo, North Dakota in 1977. I'm 37 years old. I was raised in Moorhead, Minnesota, which is the border town of Fargo, North Dakota. Growing up in Minnesota, I enjoyed many summers at my parents' lake cabin. I got to swim, make sandcastles, and just play in the sun. I have an older sister and a younger brother and many relatives that I grew up around. Uncles, cousins, aunts, my grandparents. We had a lot of fun together and I'll cherish those memories. It was wonderful. I've been passionate about art since I was a child. At age 11, I dressed up as a painter on career day for school. From a young age, I knew art was going to be a huge part of my life. I love painting landscapes and animals. I love dogs and I've been painting pet portraits since a kid. I was raised Lutheran and I've studied the Bible since I was a child. The Word of God has helped me find peace in my life. I believe God works all things together for good, even if I don't understand it at the time. I trust in Him. Right before I started my fourth grade year, my parents moved us to Tucson, Arizona for my father's work. I loved the desert environment. My parents would take us into the canyons for picnics. I really enjoyed the colorful desert sunsets and I loved living in Arizona. At age 14, I began suffering from severe abdominal pain, diarrhea, vomiting, and loss of appetite. My peers were developing into young women and I still looked like a child. I became malnourished, weighing around 60 pounds. After many doctor visits, I was diagnosed with Crohn's disease. Crohn's disease is a small intestine disease, also referred to as inflammatory bowel disease. This disease can cause strictures in the small intestine. The strictures cause abdominal pain, fever, internal bleeding, diarrhea, and loss of appetite. Crohn's is an autoimmune disorder. The body attacks itself. The GI tract contains harmless bacteria which aid in your digestion, but in people with Crohn's, these bacteria are mistaken for harmful invaders in the immune system, will respond, causing continuous inflammation. I was told I have 2 strictures in my small intestine, that there is no cure for Crohn's, but it can be treated. One treatment is with medication, and the other is with surgery. I was started on lots of different medications in hopes they would open up the strictures. I continued losing weight. My doctor ordered a Hickman catheter, which is a tube that is implanted in one of the arteries of the heart. I was then fed through that intravenously through it every night. I was put on a clear liquid diet. I was taught how to sterilize my Hickman site in my chest. I would prepare my IV every night after school. While in class, my stomach would growl because I couldn't eat solid food. The medications were not working and they were causing many side effects, one being the moon face. My face swelled so badly from the steroid medication that my peers didn't recognize me. I had a flare-up my freshman year of high school. I was vomiting repeatedly. The strictures had turned into blockages in my intestine which would need to be removed. I was rushed to the hospital and had a gastric tube put up my nose and slid down my throat. The gastric tube was pushed in and out of my nose while I gagged, trying to swallow it. My nasal cavity throbbed. It was a very painful experience. I had a 10-hour surgery with complications to remove 8 inches of my small intestine in 1992. I was 15 years old. My surgeon said my intestines were falling apart in her hands from the steroid medication. I was in critical condition for a few days and I was pumped full of antibiotics. I was then transferred to the pediatric unit in the hospital where I befriended a lot of other sick children. Seeing sick kids was heartbreaking for me. To keep my hopes up, I would draw pet portraits for the nurses and the doctors. My parents and I enjoyed getting to know my nurses and my doctors. We would even laugh and joke with them sometimes. I recovered well from my surgery and I was able to eat on my own again. I was put on the medication parenthal to keep me in remission. Parenthal is a powerful drug that weakens the immune system. It's type of chemotherapy, but it's also used to treat autoimmune disorders like Crohn's. I was told parenthal will mutate a baby, so I should not get pregnant while on it. I was told I could possibly give Crohn's to my child if I decide to have one. I began growing and developing into a teenager at this point. By my junior year of high school, I was struggling emotionally from the pain of my past. I began drinking alcohol with my peers to cope. I had a Crohn's flare-up my senior year of high school. I was hospitalized, had a gastric tube put in my nose, and I was treated with medication, which worked. Drawing in my sketchbook helped me get through that time. After I graduated from high school, I went to college at Minnesota State University, Moorhead. I graduated with a BA in painting. While in college, at age 22, I was diagnosed with shingles. It's an acute viral infection caused by the same virus as chickenpox. The virus remains dormant in the body, but people with low immune systems sometimes reactivate the virus. Since my medication for Crohn's lowers my immune system, I experienced an attack along the nerve in my lower back. I felt the pain in my back that later broke out in blisters, which burned. It was pretty painful. Getting shingles was a turning point for me. I was tired of getting sick and feeling drained. I decided to seek treatment with a psychiatrist because my mind wouldn't rest. I couldn't fall asleep at night. I knew I needed some help to move forward. I produced most of this darker art during that time. I was in my early 20s. While I was in college, I participated in the exchange program where I attended Western State in Gunnison, Colorado. I fell in love with Colorado right away. The beauty of the mountains just blew me away. I began photographing and painting the beauty of Colorado. I moved to Colorado in 2001. I began working as a full-time pharmacy technician to pay my bills, and I worked on my art in my spare time. Many people asked me to explain my darker art from college. Since it is a difficult subject for me to talk about, I decided to write a book explaining my art and sharing my story. That way people can relate without me having to relive that pain over and over again. So if you're interested in the detailed version of my story, you can read my book. It's kind of like reading my diary. I just try to convey all the emotions I was going through at that time. The book is called Raw Emotion. It's a story about battling Crohn's disease, coping through art, and overcoming adversity. My book contains paintings, drawings, and my photographs from my journey through hardship. My artist statement for that darker art is, as a young woman dealing with a chronic disease called Crohn's or inflammatory bowel disease, I feel it's important for me to share with the world my perceptions of suffering. Since disease is a part of my everyday life and memory, it often surfaces in my work as an artist. Because issues of sickness are difficult to discuss in general, the task of revealing to the viewer the pain and reality of illness is still something I struggle with. Since society does not always know how to deal with this issue, I find it extremely difficult to reveal my ideas publicly. Exposing my pain through visual art has been a healing tool for me, an outlet for other patients to relate to, and an attempt for the public to view disease through the eyes of the sick. I hope sharing my story will help other people move forward in their lives, and also to think outside the box. For example, I was told I needed to stay on my Crohn's medication for the rest of my life. Over 3 years ago, I went off all my Crohn's medications. I changed my diet to a more plant-based whole foods diet. I juiced fruits and vegetables. I would never tell anyone to go off their medication. After many years of weaning myself off my prescriptions, I decided it was time for me to try and go off of them. It was a very scary decision for me, but worth it. My gut is in remission and I'm feeling very well. I can eat pretty much whatever I want without getting sick. I'm very lucky. I live here in Colorado, Longmont, with my boyfriend, Nate, and our rescue dog, Sydney. I love living here and taking pictures of the beautiful lakes in Longmont. We love hanging out at the coffee shops in town and also at the breweries. There's Oscar Blues and Left Hand. It's an amazing place to live, and we love going to the food trucks in Prospect. I love to hike and photograph the amazing wildflowers here in Colorado. I love to paint the bright Colorado landscapes, and I hope people like them. It's really truly been the best medicine for me. It's been hiking and just being in nature. I really appreciate my life and all that I've been blessed with. I hope sharing both sides of my story encourages people to move forward into a happier life. Life is always going to be challenging with its ups and downs. I will never give up trying to do my best, and I will always look for the good in a bad situation. So I hope I encourage others to do the same. Thank you so much for listening. I really, truly appreciate it, and I hope you like my happy, peaceful landscape art. I hope to do a lot more of it in the future. Thank you so much.